All right, ladies, welcome back. It's still the morning crossfire right here, 99.3 Nigerian for today's Thursday. And every Thursday, we take care of your health and we discuss important issues regarding healthcare in Nigeria. It's Health Thursday right here on the morning crossfire, 99.3 Nigerian. For my name is Kofi Bartels. A very good morning to you. Thanks to Sheriff Quadri and Jimmy Disu for very, very interesting analysis of the big stories in today's newspapers, national dailies, concluding part of dailies today. All right, Health Thursday today looks at, we're looking at the situation in Kaduna State. Of course, we've had some stories and news about an outbreak of Lassa fever at military hospital. We want to find out what exactly is going on. And we have a representative of the Nigerian government. I want to say that. But he's from the Nigeria Center for Disease Control, the NCDC, very active during the COVID days and before and beyond, doing some great work. We'll introduce him shortly, ladies and gentlemen. But we would like to hear from you. If you call the numbers we usually advertise. Sincere apologies. I'm trying to get put some T's on cross some T's and dot some I's. But I guess this morning on Health Thursday is a deputy incident manager, National Lassa Fever Emergency Operations at the Nigeria Center for Disease Control and Prevention. Dr. Okpachi Abbah is his name. He's a deputy incident manager, National Lassa Fever Emergency Operations Center. Nigeria Center for Disease Control and Prevention. Here to talk about the outbreak of Lassa fever in Kaduna State. He's actually in the field somewhere in Borno State and shows how hard they work, to ensure that Nigerians are safe. We just think, government don't do anything. They are in the field, though, whether it's NCDC or even MBS. I know how they go to the field when they come up with those statistics. Okay, 0700-993-993. The federal government in a statement 2 days ago, precisely Tuesday, February 27, 2024, confirmed 14 cases of Lassa fever in the suspected outbreak in a military facility in Kaduna State. Last Friday, this is February 23, the DG of the Nigeria Center for Disease Control and Prevention, Dr. Jide Idris, he officially acknowledged that the outbreak of Lassa fever in Kaduna State. We had some news, but we weren't really sure. It's an army facility. And this is what the DG said, that the NCDC was notified by the Kaduna State Ministry of Health regarding deaths from suspected viral hemorrhagic fever at the 44 Nigeria Army Reference Hospital in Kaduna. Following this, the NCDC, he said, is collaborating with both institutions to investigate and respond comprehensively. Dr. Abbah, can you please tell us some more about this outbreak of Lassa fever at the 44 Nigeria Army Reference Hospital? We hear some lives have been lost. Dr. Abbah, if you can enable your audio, can you kindly expand on what exactly is going on there in Kaduna? All right, Dr. Abbah, you're muted. Please kindly unmute yourself. Hello, Dr. Okpachi Abbah. Can you hear me?
Yeah, sorry.
Okay.
Yes,
Okay. Yeah. Please go on.
I can see.
All right. So please tell us what the NCDC knows about the outbreak of this bout of Lassa fever in Kaduna State at the 44 Nigeria Army Reference Hospital.
Okay, so the index case was a 27-year-old female whose illness started about the 9th of February. Well, an index case is the first case that presents at a health facility. So, but died on the 20th of February. The symptoms presented with were fever, headache, convulsion, bleeding. But the bleeding was after a bite due to the following the convulsion or during the convulsion. So after this, they have been a number of other cases. So far, a total of about 10 cases have been recorded there, and 6 samples that were received, 4 tested positive. I guess that is already out as information. 3 out of the 4 positive cases were lost with the case fatality rate of 75%. There was one probable case. Probable case generally is a case that you think from all indications should be a Lassa fever case, but there was no test done. Either the person absconded or died before samples could be taken.
All right. Just to confirm, how many have died from this particular incident at the 44 Army Reference Hospital in Kaduna State from Lassa fever?
So, like I had mentioned, 3 out of 4 positive cases died, and that is a case fatality rate of 75%. This is an unusual one,
Okay.
But the state and of course the Nigeria Center for Disease Control under the leadership, the new DG, Dr. Jide Idris, swung into action, and there have been response teams on the ground. The state response team was activated immediately. Contacts have been line listed. Massive community engagements are on, calming the people that Lassa is not a death sentence. A high index of suspicion is what is required, and healthcare workers are being sensitized to increase the index of suspicion. Because the thing about Lassa fever is it presents like any other febrile illness. You have the headache, you have the fever, you have the malaise, the sometimes cough, no cough, chest pain, no chest pain. It is quite fluid. The myriad of the deck of symptoms, but generally it will come like if general feeling of unwellness, bleeding, convulsion come at a much later time from the contact with the virus, which because we should talk about. I guess that is going to come in soon.
Yes.
So and the period is between 3 to 21 days of the contact. So I guess I would wait for that question to come.
All right. Thank you. Fantastic. Yeah, for those of you listening, if you'd like to contribute, maybe with a question or you have a contribution, please feel free to call the number 0700-993-993-993. You can also call 02 for our female listeners, 0201 465 7190. And of course, we have a WhatsApp number available just for messages this time, 08095975805, 08095975805 for your WhatsApp messages. On Facebook and X, search on Nigeria Info FM or Nigeria Info 99.3. Of course, let's quickly remind you that the OnePlay.ng lottery draws will be held live in the studio this morning before I go. So head on to the website, www.oneplay.ng. That's number one and the word play together, oneplay.ng. Click on the box that has the logo of Nigeria Info 99.3 Lagos. All right, there's a button there that says play for 500 naira. You can buy one ticket, one or two. but one ticket goes for 500 naira. We're giving out 10,000 naira to 5 lucky winners on the One Play Lottery live draws we'll have before I leave the studio this morning. So get playing. Go to the website now, www.oneplay.ng, number one, and the word play.ng. Doc, so please tell us about Lassa fever. How many cases are you following and monitoring across the country, apart from Kaduna? Yeah, Dr. Abbah, you're muted. Can you mute yourself?
Okay.
Oh yeah, we can hear you now. Please go.
So yeah, I got the question. As at February 28th, they have been at 477 confirmed cases and 85 deaths, with a case fatality ratio of 17.8% in 24 states across. This coming from 89 local government areas. So these are confirmed cases.
Is it this year? Yeah. Within which period, please? For this
within this year, from January 1st till 28th of February.
Okay.
This is the data available. The data available is for confirmed cases are 477. Of course, they had a larger number as suspected, but those confirmed as cases are 477. 64% of all the confirmed cases actually were reported from 3 states. And remember, I had said that the 477 confirmed cases are from 24 states, meaning 24 states have reported at least one confirmed case since the beginning of the year 2024, and this shows the spread. So going back to the 64% of all the cases being from 3 states, they are Ondo, Edo, and Bauchi. Ondo reporting 25% of the cases, Edo 23, Bauchi 16.
Okay, interesting. What is it about last? Okay, we have a caller coming through. I'll put him or she. Oh, it is. I lost that. Sorry about that. I didn't see the call earlier. 0700-993-993-993. What is it about? I mean, you talked about the cases outside the one in Kaduna. We've had a 17% fatality rate, but for the case in Kaduna, this recent bout, it's a 75% fatality rate. What accounts for the high fatality we're recording in Kaduna? Is it known yet, based on your findings? We'll come to you shortly to answer that question. Dr. Abbah, let's take this call. Good morning.
Hello, good morning.
Welcome. Your name and contribution or question?
A question.
Yeah, what's your name?
Yeah, although it's not related, let me first of all begin from where I want to start.
Is it related to what we're talking about?
No, it's regarding the last edition. That's last Thursday. I just want to clarify a point.
Okay, we want to stick to what we're talking about now. Maybe you can send a message to our WhatsApp line 080-9597-5805. Dr. Abbah, so tell us about this high fatality rate. Is it known why it is this high for the latest one in Kaduna State?
Okay, so it began as high, and which is not extraordinary for outbreaks, okay, especially in regions or states that are not known to be endemic with the disease. So an endemic state or region is where the threshold is higher for you to declare an outbreak. Usually, one case of Lassa fever is an outbreak because it's a viral hemorrhagic fever. But in some places that are more endemic, the threshold is higher. So Kaduna, it doesn't come as one of those places, and this is one of the characteristics of outbreaks. It doesn't follow our maps. It doesn't usually follow our maps or timings or leanings. There are things that could lead to this. So, but that was as at that time at the beginning. Currently, it is much lower. It is much lower. It's about because then there were 3 cases. Now, from that beginning, the first report till now, it is not only, but it is 6 out of the 10 confirmed cases, CFR of 60%. But as I mentioned, the Kaduna state government immediately they made a press release. They briefed the public, also the leadership of the 44 Army Reference Hospital at the press release, and so there was that collaboration with the Nigeria Center for Disease Control under the leadership of Dr. Jide Idris, providing immediate support prepositioning of response materials and sensitizing communities immediately, distributing IEC materials as information, education, and communication materials, and engaging the public immediately. Okay. So, yeah, I think the fears have been quite allayed over at Kaduna now, and response to the teams on ground.
Okay, for the states, the 24 states that you were referring to, that you've recorded, NCDC has recorded cases, at least one, of Lassa fever. Is Lagos part of them? And if so, tell us some more about Lagos State.
Okay, thank you. Yes, Lagos is one of those states. And Lagos is not one of the endemic states for Lassa fever. Of course, being the most populated state in Nigeria, and then also being in the west, where we not so close to Ondo, but of course being in that region, it's actually great to know that the endemicity of Lassa fever around Ondo, Edo has not occurred in Lagos. Yes, there was a case of Lassa fever in Lagos State that has been reported, and this is just that came in week 6 of 2024. Yes.
Okay, so just one case of Lassa fever in 2024 in Lagos State.
Sorry, just say again.
So you're just saying one case of Lassa fever reported in Lagos State in 2024.
Okay, well, what I meant by the one case is confirmed case. One confirmed, yes. There were 3 suspected cases, but a total of 6 suspected cases, and one was confirmed.
All right. This one confirmed case, is there any sort of tracing to know how he or she contacted the disease?
Okay, so yes, investigations were done, preliminary investigations, and then in-depth investigations are ongoing. A team is even arriving to support Lagos from today. I learned yesterday a team is supposed to be on ground to support the activities of the Lagos State Ministry of Health, and then they will also provide more information.
All right, Dr. Abbah, hold the thought. We want to go for a short, quick commercial break. When we come back, we'll talk some more about Lagos State. Stay with us, please.
Yeah.
Now, ladies and gentlemen, for the past year or so, OnePlay has been putting money in the hands of Nigerians every other day. Now, that has no plans of stopping anytime soon. Definitely not today, because OnePlay is now up in the take. It is going to be 150,000 naira and over from here on in. Yes, you heard me. Daily winnings are now over 150,000 naira. All you have to do, the process has not changed. Go to www.oneplay.ng or dial star 347 star 880 star 3 hash from your phone. You can play with as little as 500 naira, and within a few seconds your ticket will be in the draw. Remember, the lowest ticket you can play for is 1, the highest being 10. The more you play, the better your chances of winning every day on each of the shows: the Morning Crossfire, What's Up Lagos, and Game On every other weekday. And on weekends, you can win on Football Frenzy. But that's not all. Every other Friday, there will be the 500,000 naira jackpot. You heard me right. 500,000 naira. That's 5 with 5 zeros behind it. Yes, 500,000 naira will be given out every Friday in the weekly jackpot. Now, playing during the week automatically qualifies you for the weekly jackpot. Your chances of winning are the same as whether you play with www.oneplay.ng or dial star 347 star 880 star 3 hash. Remember to play responsibly and make sure you are over the age of 18 while you play. Remember, OnePlay is a registered trademark of Lassa Trading Services Limited, licensed by the Lagos State Lotteries and Gaming Commission.
This is an infomercial.
All right, we'll go for another set of commercials. When we come back, we'll continue our talk with Dr. Okpachi Abbah from the Nigeria Center for Disease Control. And we're looking at the outbreak of Lassa fever in Kaduna and by extension, the situation across Nigeria. Please stay with us.
Anywhere Clara enter like this, people must give am compliment.
Clara, this your sense make sense o. Na because I dey use Wazobia.
Anywhere Johnny enter sef, people must comot cap for am. Johnny. As you enter like this, everywhere just begin smell nice. Which kind perfume you dey use?
Na Wazobia perfume o.
Yes sir, Wazobia na the correct scent wey get quality. E dey last long and e dey give man and woman confidence any day, anywhere.
For authentic scent wey dey indigenous, make you choose Wazobia.
E dey available in perfume and body spray.
You fit get am for stores, supermarkets and open market.
Remember, no be only how you take dress, na also how you take smell.
Wazobia, correct scent for correct people.
Alright, no farm. My name is Brother Shaggy, aka Mr. Rob. And I can't tell you, say Rob they deliver fast and long-lasting relief for muscle aches, joint pains, and symptoms of cold and catarrh. Robin, in out.
Hey! Dear Glow subscribers, are you aware of the new directive from the Nigerian Communications Commission, NCC? You could lose your mobile number just like that.
Unless you link your Glow SIM with your NIN immediately, your mobile number will be gone.
Don't let this happen to you. Act now and save your precious mobile number.
Just dial star 996 hash to check your NIN linking status. Follow the steps and visit any of our Glow outlets or SIM registration agents close to you. You could also visit the NIMC office close to you to get your NIN registration done.
Make sure your number is safe and secure. Don't delay. Do it today. Remember, SIM registration is free.
Glow Unlimited.
Cornerstone Children Education Fund. I will always be there.
Oh, yes. Invest in Cornerstone Children Education Fund and enjoy an interest-yielding savings investment plan that doubles as a life insurance policy for your children's education and attractive interest rate. The policy can be used as collateral and serve as a life cover. Visit cornerstone.com.ng. Cornerstone, the future assured.
Lagosians prepare for a spectacle of legends. Dambe Warriors unveils its Grand Super Fight 2 finale this Sunday, March 3rd at Moriokuola Park, Victoria Island. Witness the clash of titans as number 1 and number 2 contenders vie for Dambe's largest prize ever. Yaramage faces season 1 champ Zeyano in lightweight, while Ramadan battles Sha'aban in middleweight. In the heavyweight showdown, Dogo Mekakwasara vows to vanquish Ali Kadim Bello. 12 fighters compete for 6 spots in season 3. Get tickets at afritickets.events and join us with sponsors like MTN, BetNiger, Hero Hunter, Powerbites, Infinite Energy Drinks, Indomie, Hypo, Power Oil, Colgate, Pop Cola, Amstel Malta, Optimus by Afrinvest, Lotsan, Promo Media, and ICO. For event tickets and exclusive content, download Dambe Warriors app on Android/iOS. Follow us on Facebook, Instagram, YouTube, TikTok, and X. Long live Dambe Warriors.
The round of 16 of Nigeria Info's I Beg to Differ debate competition ends on Thursday. At 4 o'clock, Adekwetu Adenike and Babalola Deborah Toluwalope will debate the topic. Banning single-use plastic products will hurt the local economy. At 5 o'clock, Ifeanyi Blessing and Mushafau Farida face each other on the topic. Youths under 35 should be prohibited from relocating abroad. I am Yvonne Ochaifo. Join Femi Obong-Daniels and me as the judges pick the last 2 debaters for this round to join the quarterfinals. I Beg to Differ Season 7. 32 debaters, now 16. 1 winner, 1 million naira. Sponsored by Maybrands, supported by Obiwizi and Just Food. For sponsorship, send an email to info@nigeriainfo.fm. I Beg to Differ, a tournament of champions.
You are listening to your number 1 station for talk.
Your number 1 station for talk.
99.3 Nigeria Info. Let's talk.
Live from the heart of Victoria Island, you're listening to your number 1 station, 99.3 Nigeria Info. This is Morning Crossfire on 99.3 Nigeria Info.
Welcome back. It's still the Morning Crossfire right here on 99.3 Nigeria for Dr. Abbah is still with us. He is from the Nigeria Center for Disease Control. As a matter of fact, he is a Deputy Incident Manager at National Lassa Fever Emergency Operations Center at the Nigeria Center for Disease Control and Prevention, NCDC. So it means that if anything happens, he's there. If there's any outbreak, he's there. I hope I'm right, Dr. Okpachi Abbah. He joins us. He's on the field as we speak. He's in Borno State on the field. It shows you that these agencies of government, they work, contrary to what some of you believe. All right, welcome back. My name is Kofi Bartels. 0700-993-993-993. Yes, this Lassa fever latest one, the outbreak may be in Kaduna State. But like you heard from the doctor, the incident, the infection rate is quite high. The fatality rate, rather, is quite high. He said about 70-75%. And it's something they're concerned about. But we want to know how it affects all of us in Nigeria. Kaduna is part of Nigeria. But he also was telling us about Lagos State, that in 2024, they have had 1 confirmed case. And he was trying to give us some more information regarding that. He said that this was out of 6 suspected cases, 1 confirmed case in Lagos so far. It's nothing to be alarmed about, but he's just here to give us information, not to alarm us or to scare you. No. They're in control, they're in charge. He says the NCDC has sent a team to collaborate with the Lagos State health authorities, to try and make sure they bring any other situation under control, really. Dr. Abbah, tell us some more about the Lagos State. Because I was asking you, and you were telling us about the investigation to know where this person contracted the disease. So back to you. Kindly unmute yourself Dr. Okpachi Abbah.
While you were on earlier, in restarting the session, you had mentioned 75% as the case fatality rate for Kaduna. Just to have that in proper perspective, yes, that was mentioned, but that was at the beginning.
Okay.
But I already cleared that currently it is down to 60%.
60%. Sorry, thank you very much for that clarification.
From confirmed cases.
All right. Thank you.
So on to okay.
Yeah. Go on. Yes.
So on to Lagos. Well, yeah, we had said that there's just been let me not say just, because one case it's very very important.
Yeah.
Yes. So we are only supporting the efforts of the Lagos states, of which you have highlighted. They have actually taken decisive steps. Please, my internet was interrupted.
Okay.
Can you confirm that?
Yeah, we can hear you.
Yes,
yes, we can hear you. Please go on.
Okay. Yeah, so Lagos State Ministry of Health took very decisive steps, and some of the investigation is still on. We will more information about this will be provided by the Lagos State Ministry of Health. But what we can say is that cases are not increasing in Lagos, but the index of suspicion has been heightened, and healthcare workers are being sensitized even at across all the LGAs. And of course, Lagos is a state that has a lot of influx. People go in and come in a lot, so there is increased risk communication, and then healthcare workers are being sensitized. Interestingly, testing for Lassa fever is free, and Lagos State has a testing laboratory in collaboration with the Nigeria Center for Disease Control. We have about 9 testing centers, and more centers are being assessed for optimization. And the new DG is building on the former DG's increase in number of testing capacities. Will increase that. But Lagos has always had a testing center.
All right.
Yeah. And testing is free.
Free. All right. Yes. Interesting. Let's go to the disease itself. Viral hemorrhagic fever, Lassa fever, are they the same thing? What is Lassa fever? When I hear hemorrhage, I think of blood. You're the expert. Tell us what exactly is Lassa fever and what causes it. What do we need to know about it, Dr. Okpachi Abbah?
Okay. Thank you very much. Yes, viral hemorrhagic fevers are a class of disease that have fever as a mainstream kind of symptom. It doesn't appear in all, but the hemorrhagic there, yes, you're right, it relates to blood, can lead to bleeding from the orifices, the eyes, the ears, the nose, the mouth, and other openings in the body. But I must say that this usually comes at a much later stage of the infection. And we say this, that early presentation is key, that Nigerians, it's our collective responsibility to maintain personal hygiene, and we'll come to what we should do. But talking more about the disease, it is caused by a virus. The name Lassa actually comes from where it was first identified.
I see.
It was first identified in Lassa town, in in Borno State. So that is why they call it the Lassa fever.
Okay.
Actually, before then they had been around West Africa, especially as Sierra Leone, cases they could now relate to similar symptoms, but the first identification of what causes it was in Lassa, where two missionaries, foreign missionaries, died, and the samples were taken and analysis was done, and it was discovered that a virus caused this. So should we go on now to
how is it
modes of
contracted?
transmission?
Yes, thank you. Modes of
Good.
transmission. Thank you.
Okay, modes of transmission. It's by direct contact with urine, feces, saliva, blood of infected rats. Of course, contact with household items and surfaces contaminated with the urine, the feces, and saliva, blood of rats can also lead to that. Consuming water or or food contaminated with feces or saliva or blood of infected rats also can lead to that. I must say that the rats are the reservoirs. The particular rat is the multi-mammate rat. But you can't tell rats to flip over that you want to confirm they are multi-mammate, they have many breasts for you to know. And it's not only in those ones, they have been found in other rodents. And there is a current finding that some other household animals, like pigs or dogs, have become reservoirs of it. But this is, more findings are being done.
All right.
So, but the rats, the multi-mammate rats, their urine, their feces, the saliva, the blood, and then person-to-person transmission can also occur through the blood, the fluids of, even vomit, the fluids of an infected person. Transmit the signs and symptoms usually begin to appear, as I said earlier, between 3 to 21 days of contact, and it presents initially like any other febrile illness, such as malaria. So early treatment and diagnosis increases chance of survival.
All right.
The symptoms: sore throat, general body pain, weakness, like we had said before, vomiting, diarrhea, muscle pain, chest. It's a myriad of symptoms. No single person has all of it, but the bleeding. So to allay your fears, the bleeding, unexplainable most times, is usually at later stages if treatment is not sought early.
All right, that's very important information. Talk to us about risk factors. You doctors always talk about risk factors. Is that the case in this situation?
Oh, sure. Yeah, they definitely are risk factors. First, we are experiencing climate change, and this has affected, even looking at it from the One Health angle, that is the human, the animal, and the environment triangle. More bushes are being burnt, less food is available at this period for the rodents. They look towards human habitations to feed, and that is the rats bringing Lassa home. Also, hygiene, the personal hygiene, is one of those factors. Dump sites should be far away from human habitations as much as possible. Dustbins should be closed and emptied as frequently as possible, reducing the chances of the rodent-human contact. And then other aspects of personal hygiene, the washing of the hands under running water with soap, or using of sanitizer, and covering our food. Very importantly, we covering our food so that rats do not have access to it. The dry food, the cooked food, the ones left over the night, and this food storage. The holes that rats use to access our homes should be blocked. Some are engaged.
Yeah, please go on. Sorry about that.
Okay. Environmental sanitation, and then just to mention this, we at the National Center for Disease Control, they activated the DG activated the incident management system
All right.
in January in response to increasing number of cases, and the Emergency Operation Center coordinating it actually has many pillars. The technical working group that translated to the emergency phase has many pillars, and is collaborative. Other ministries, departments, and partners are involved. Mentioning environment, the Ministry of Environment will lead on the environmental aspects.
Yeah, talking about the environmental aspect, a lot needs to be done in that regard, Dr. Okpachi, because in some countries there are laws that say you can't sell food without being covered. It being covered, maybe you put it in a show glass, or a show glass, but not a show glass, but the one that has net. If you can't afford a glass. But here we find that people sell all sorts of things in the open. Flies perch on them. For instance, Gary is one of the major things that rats feast in. Sometimes when you buy your custard bucket of Gary from the market, and you see rat feces inside. I remember some years ago, I used to see rat feces in the Gary. You just have to imagine that the market woman store was a playground. That Gary bowl of Gary or basil was a playground. They were playing in it.
You have a lot of imaginations.
Yeah. So
you're not alone on that. Yeah.
So what can we do in terms of regulations to ensure that on the environmental and hygiene aspect that we're protected food-wise?
Okay, thank you very much. Yes, definitely. The government is not sitting on this. Like I said, it is a collaboration, and the Ministry of Environment is actually they're taking the steps to mitigate this. Yes, there's also a lot apart from rodent control activities that they lead on. Which the EOC, the Emergency Operations Center at the Nigeria Center for Disease Control coordinates. There's rodent control in high-burden states, working with their desk officers, and then sometimes sending teams.
I've never seen any rodent control in my life in this country. But I'll come back to you on that. Please hold the thought. Sorry about that. We have a call out of the line. Hello, good morning. What's your name and contribution?
Good morning.
Good morning.
Kofi. Good morning, doctor. This is Oboli calling from Ikorodu.
All right, good to hear from you.
Doctor, I have a question, please. I remember Lassa fever broke out a couple of years back. So I'm wondering, don't you think if precautionary measures were taken rather than reactive measures, it would have forestalled this? That's number one. Number two, for areas that this Lassa fever is quite endemic, do you think it has to do with the poor medical facilities in that area? What do you think is responsible for this outbreak that is so severe, since Lagos State is not like that? Thanks and God bless.
All right, Mr. Boli, you've eloquently marshaled your question. I think you should be sitting in this chair. Thank you very much for your time. All right. Dr. Abbah, yes. Very important question.
Came very directly, poignantly. Yes. Okay, thank you. So about being proactive about it, I would like to state very categorically, and also you would agree easily that if proactive measures were not being taken, it should have been a lot more. You said it broke out a few years ago, meaning you didn't hear anything for a very long time. So the Ministry of Health over at Lagos, the NCDC, and then the ministries of health across the country actually take a lot of steps in integrated disease, surveillance and response from the ward level, the communities, to the local governments, to the LG level as local government, to state levels. So with support from partners, so that is why you actually had a break, so to say. Proactive measures are being taken. However, more needs to be done.
All right.
And they're talking about where we have them in endemic, the endemic phase. It is not it is the reasons are a few of them, and I can mention. To begin, you mentioned poor health facilities. That is about the last stage of the determinants to see the outcome. First of all, it is the low index of suspicion. No, even before that, the way we behave, behavioral, requiring behavioral change. Not everybody is at the same level of knowledge. Yeah, Kofi, you mentioned that you bought Gary some time, and you see rat feces and you'll be wondering, did the rat have a field day on that? So spreading food openly in some of these places, and a lot of work actually has gone into risk communication, community engagement, engaging with special groups on this. Then the myth that it is witchcraft, it is not it, or it is something else is another one. Not presenting early for treatment.
Okay.
Personal self-medication is one of those factors.
All right.
Yeah, it's headache, and then so it's a combination.
Dr. Abbah, before you go, I will give you maybe a minute to to just give a message, a final word to those listeners on what they need to do, just to re-echo what you've said. But also just in maybe 30 seconds, tell us about the de-ratification exercise that the federal government announced. Is this something the NCDC is aware of? Can you speak to that very briefly, please?
Okay, so beginning from that and then ending with the last words.
Yeah, in a minute. Yeah.
Okay, in the whole of 60 seconds. Thank you. The ratification exercises are not new. A number of them have been done in the endemic states, in some of the states like Ebonyi recently, some time ago, not so long ago. And then the communities, although the findings are still coming around, those communities that the rats are removed from, and then you get to see that probably about a percentage up to 30%, sometimes 40 or less, 25% are the mastomies, the ones that carry the rats, are beginning to record fewer cases. And so this is more or less maybe increasing it. The Ministry of Health has come out clearly on that and other strategies. And in conclusion, to make it very clear that the Nigeria Center for Disease Control and Prevention has adequate public health system to diagnose and respond to cases of Lassa fever in Nigeria. Nigerians, it's our collective responsibility to maintain personal and environmental hygiene. Healthcare workers are encouraged to remain vigilant in vigilant detection, immediate presentation at health facilities to increase chances.
Thank you very much.
Thank
you very much.
Yes, I wanted to also add, because they should know that they can call their local health authorities and report
Thank you very much.
If they need.
99.3 Nigeria Info. We'll be right back. Do you want your children to excel in STEM subjects? Enroll them to
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3